Welcome back to Yankee Chronicle. I'm your host, Abby Peel. As the leading provider of home health care services in the Lake Sunapee, Upper Valley, and Connecticut Valley regions of New Hampshire, the Lake Sunapee region VNA and Hospice provides an unmatched quality of care to those it serves. It is the preferred place to work and volunteer and remains an adaptive and enduring presence with an unsurpassed breadth of service offerings. Laura James had a chance to sit down with their president to hear how this is accomplished. Hi, Laura.
Thanks so much, Abby. We're here at the Lake Sunapee Region Visiting Nurse Association and Hospice. We're speaking with Jim Calhane, who's, make sure I get this correct, the CEO and president.
That's correct.
Oh, great.
That's correct.
Thank you for having us today.
Thanks, Laura. Great to be here.
Yeah, boy, do you have a rich history, this
do.
Organization, the Lake Sunapee Region VNA and Hospice.
We do. For 52 years, we've been providing services in the communities we serve, and we currently serve about 28 communities, providing home care hospice services, palliative care services, our community health services, really designed to help people keep them in the home for as long as possible.
Well, you know, those of us who live in the area are so familiar with what we just call the VNA.
Yeah.
And it seems that it's been a part of everyone's life.
Yeah, it really has. I think our long-term, the services we've been providing in the area in conjunction with the support and the communities that we serve, the long-term friendships that we've had in the community, the partnerships that we've created in the communities that we've served have really allowed us to really provide and impact the people that need the services most.
You know, Jim, you mentioned friendship and support.
Yeah.
That's not something that happens overnight. What do you think that came from?
Oh, you're absolutely right. These are long-term relationships. This is the long-term engagement of people who have had our services, people who have known people who have had our services, and people who just support the need to keep people in their homes for as long as possible, because that's the location that people want to stay when they're not feeling well, when they're ill, or if they're at the end of life.
It's true. It really is. And, you know, as we grow older in our years, right, those of us, again, who have, been in the community and supported the VNA are now using the services.
Absolutely. Yeah, we see a lot of people that who have been supporters of the organization for years, largely needing services to help stay in the home, whether it be physical therapy services or nursing services or services just to help make home life a little bit easier. We've been around for quite a while, and as such, that's what we feel our mission is, and that's what we try to support people.
And it's funny, that mission really hasn't changed in those 52 years. There are new services and new options for people, but it's been a very steady message and mission.
It really has. I think that's a really good point, Laura, which is people want to be in their homes. When they're in the hospital, they want to go home. When they're in a nursing facility, they want to get better and they want to go home. Our job, as it has been for 52 years, is to help people stay in their homes.
Now, Jim, I'm going to dive into some of those services because I think that's really important. But I want to hear more about you. So what, 15 years or so? How long have you been, since 2015?
Since 2015.
2015,
yeah,
right.
So about 9 going on 10 years.
That went by quickly because you were new to me. I said, I've heard of Jim and he's new.
It has gone by quickly. It really has. I've been in the industry for a little over approaching 25 years. But I think, my love for this area, my love for the work that we do, and the great team that I have with me here at Lake Sunapee VNA makes the time go past quickly. That having been said, I'm not going to sit here and state that healthcare is healthcare is not an easy industry to work in these days. There's a lot of complexities, whether it be staffing, which is tricky, whether it's the regulatory world that we live in. But our job, and it has been for 52 years, continues to be the home care provider, the healthcare provider in the homes of the communities we serve.
So what initially brought you here? Was it the community, or what attracted you to the VNA? I
was familiar with Lake Sunapee VNA even before I was here. I had known some previous people that had worked here, so I was somewhat familiar with the work that was being done here. My familiarity with the work that was being done here, as well as my experience in home care and hospice, it just seemed like a great fit at the time. I think the needs of the communities, although not unique to this general area, as I was familiar with the area prior to arriving, my familiarity with the number of people that had worked here, I just felt it was a really good fit for what I wanted to do, what I think Lake Sunapee VNA, the board, and the management team wanted to do. It just seemed like it was a very cohesive fit.
I know they've been very happy to have you here. And I wish I could use happy as a word that you've experienced in the last few years. These were tough times to navigate, weren't they, through COVID?
Yeah, very much so. And though, again, not unique to Lake Sunapee VNA, healthcare has been complicated the past few years, as we're well aware. Whether it be the relationships and partnerships we have with the hospitals we serve, such as New London Hospital or Valley Regional Hospital or Dartmouth-Hitchcock, whether it be some of the other assisted living facilities that we partner with, it has been a tough time. It's been impacted by COVID was a substantial hardship, as it was for everybody. Staffing has been complicated. And it has been something, while I'm very pleased to say that we're successfully navigating, it is definitely a different industry now than it was just a handful of years ago.
Jim, tell me more about staffing.
Yeah, absolutely. You know, we live in an area which has really some wonderful medical care, but unfortunately, the number of staff needed to service not just this area, but a lot of areas in the state and in the region are falling below the need that exists. So when we partner with Dartmouth-Hitchcock and the number of patients and the number of nurses that they need, or we're partnering with New London Hospital and the work that we do with them, the number of nurses or other disciplines such as licensed nursing assistant is not keeping up with the pace of the demand for the people that need those services.
Sure.
So that shortage of supply of staff, whether it be nurses or licensed nursing assistants or therapists, does impact, and it alters the way in which we provide care. And our hope is that through a variety of measures, not some of which is legislative, some of which is just career trajectories, we start to see some improvements in how staffing works in the communities that we serve. But it's an area we focus on quite a bit.
Well, we'll be running a scroll of information as to how people can get in touch with you, should they have, a desire or time.
Absolutely.
Or need to. Tell us about your volunteerism.
We have a lot of volunteers. Volunteers are a core component of what we do for a variety of programs. One of our programs is our Good Day Respite program, which is our adult day respite program, heavily staffed by volunteers. They do the bulk of the work. We have a hospice program, which again relies heavily on the volunteers that work in that program to not only provide kind of administrative services, but also to provide direct patient care services as well. We also have the Renaissance Shop, which a lot of people in the community are aware about, which is our resale shop downstairs that is almost exclusively volunteer managed and serviced. So we rely on volunteers a lot, and I'm really thankful to say that we've always had a very, very strong volunteer participation in this organization, and it's the backbone of some of the services we provide. It really is. Yeah, it really is.
So, the hospice program is wonderful. The Renaissance Shop has been a big part of our community.
Yeah.
Tell me a little bit more about Good Day Respite. How
sure.
significant is that?
Huge program. So this is a program that we ran both in New London as well as in Lebanon prior to COVID. COVID closed both programs down for obvious reasons, which is contact and potential infection control issues made a respite or adult day programs tricky to run. After we received, for lack of a better word, the green light from the state that that COVID was sufficiently low enough to begin to reopen, we did, and we reopened last May in New London. And the demand has been substantial. I will say, of the programs we operate, and the programs that unfortunately had to either reduce, contract, or close over the course of COVID, we received numerous phone calls from the communities to say, hey, listen, this is a program I've taken advantage of in the past, and when is it going to be open, because we need it. And sure enough, 6 months after we opened our New London respite program, we had a wait list because there was that much of a demand. It continues to be a needed program in the community. It continues to be in demand. We are considering increasing the hours and availability of the program next year because that demand continues to be there. Focusing on the social supports and the respite needs of individuals with memory impairment is there's a substantial lack of services in the state for some of these, not just the clients that we serve, but for the caregivers. So our focus in continuing to develop that program and expand that program is what we're going to be looking forward to.
I think that's an understatement. As our population grows, there is such a need for this.
Absolutely.
So,
absolutely.
Not to go on and on about it, but the Good Day Respite program, Tell us about what can you expect if you have a family
Absolutely.
member. What happens during the day? And
Absolutely. Again, primarily staffed by volunteers, overseen by an LNA and a nurse as well. So it's really primarily geared towards a respite for the caregiver for the individual, and it really focuses on socialization and activities for the individuals that will attend. So an individual can attend for 1, 2, 3, 4 hours at a time, several days a week, and they come in and we have prepared food as well as activities just to help them engaged and socialize throughout the course of the day in the time that they're there with us.
how wonderful it's open again now. I know that COVID is being managed. I always want to say post-COVID, but it's not post.
No.
It's just being managed now. So
it is. You know, we're fortunate, again, another program that that the generosity, both in time and resources from the community, allows us to open up and provide this really crucial services to individuals. Memory impairment is an increasing issue, and support for caregivers and clients with individuals with memory impairment is an increasing issue. And again, we're just trying to fill that gap as best as possible.
Thank you for your work on that. That's so appreciated by the community. So tell us about some of the other services that we can expect from the VNA.
So we have a number of things. So home care services, hospice services, and palliative care services have really been the primary driver of our health care services. There are several other services we provide. We provide services to Medicaid, what are called Choices for Independence programs, as well as grants. Those are really more long-term care supports, really the needed services that people need to have in their home that prevents them from being placed in someplace other than their home. Our goal is to increase the supports in those services. Our goal this year for 2024 is to really invest more time and resources to expand those programs, because the more people we can keep out of facilities and nursing homes, the better they are. It's more financially advantageous as well. So we're going to be investing more time and energy in trying to provide more support to our long-term care supports that we have in the organization.
So Jim, let me just put this in language that I understand. So if I have a family member and I'm trying to make the decision, you know, what direction do I take? I feel I'm not perhaps giving them the amount of care that they could or would or should have. I can call the VNA and ask for help? Absolutely,
and that's an excellent question, Laura. There is a very low threshold to just contacting the VNA, explaining some basics in terms of what you think might be helpful, and we will walk you through what services are available, where we think services should be plugged in, whether it be a long-term care support, whether it be a nurse, whether it need to be a good day respite type of program. We are ready, willing, and able, and actively engaged in trying to answer questions from the public in terms of where can we help, what services do we have available to help people stay in their homes.
And here's what I know about the VNA: everyone is very long on compassion. When someone calls you and says, "My parent is dying, and I need help," you're right there. We pride ourselves on our responsiveness. We pride ourselves in supporting the community. When people call in, and they do regularly, and say simply, "I'm helping to take care of my mom and she's struggling at home," or I'm working with my father and he's not doing well medically," that is all the information we need to begin going down the road of identifying what supports are necessary to help that person in the home. How fortunate are we? We really are. Now, you mentioned one of your other responsibilities, and I'm sure it's not an easy one, it's the legislative process. Or do you navigate those waters too?
We do. You know, because we're a healthcare organization, the regulatory world is a lot of what we do. We are a Medicare certified organization, so as such, the rules associated with Medicare are something that we navigate as well. But healthcare is not only just in our domain, it's really in everybody's domain, and continues to be at the forefront of a lot of legislative activity, both at the national and state level. So our goal is to make our voices heard, to really advocate on the behalf of the clients that we serve, to really try to promote and develop healthcare and a healthcare system that is as best and as advantageous as is allowable and can be provided. Resources are always limited, especially in the realm of national and state politics, but we feel as if there's the need for greater investment at different levels, at the state and national level, and we advocate for that.
That's wonderful. It really is. And fundraising is a big part of your position too, I would imagine.
Absolutely. Fundraising is really important. Philanthropy is really important, because we've really spent the time and energy and have been around for such a long period of time. We've really focused on our friends, the friends of the organization, that have just demonstrated time and time again a strong commitment to what our mission is. And we are extraordinarily blessed to have such a commitment from a number of people. donations, philanthropy, not only in terms of resources, but in terms of time and volunteer hours. It's substantial, and it can't be overstated. It's really impressive.
It is impressive. I remember as a young mother in the community, young parent, the Lake Sunapee Region VNA was always in the forefront, and a lot of it was the fun we had at your fundraisers. You had great fundraisers. We would go and donate and enjoy it, and then find out more about the organization.
Yeah.
So that outreach into the community was huge. Now,
absolutely. Fundraisers are important for us. The engagement with the communities are important to us. We have a number of key events every year. One of the largest is the Women Who Make a Difference luncheon. Wonderful event, as well as we have several events that we have in the fall. We celebrate Hospice Month and Home Care Month in November. And this year, in 2024, we're going to be celebrating the 20th anniversary of the Renaissance Shop, which is, again, our volunteer-driven real social. 20 years.
Oh, my gosh.
Yes,
when that
20
started,
years.
Isn't that amazing?
20 years that this volunteer-driven resale shop has been working tirelessly, the proceeds of which go to support the mission of the VNA. And it has been an impressive 20 years.
I have a very dear friend, and she's a snowbird, and the first thing she does when she comes back is runs down to the Renaissance shop to see what she has missed over the winter. So that has had a huge impact on the community.
Yeah, it really does.
So if we are looking to help, what's the best way for us to do that?
I think, from a general public standpoint, we like to promote education. I think it's important to educate themselves in terms of what healthcare is around their community. I think in our world, what we frequently find is that people ask for our services at the last moment when the doctor notifies them that there's a problem, or when they're in the emergency room, or when they're in the hospital. Education and understanding what services are available before you need them, before you need hospice services, before you need home care services or long-term care supports, has always led to a better outcome for families in terms of what is it they would like to do. Do they want to stay in the home? If so, what do they need to do to make that happen? Proactive education has always been something that we've heavily promoted. Education in the communities in terms of our services has always been something we've heavily promoted. And as such, we continue to think that the more we can educate, the more people are aware of us, the more people can get questions answered in a timely manner, the better they are in terms of meeting their needs.
Education and knowledge, both power.
Absolutely.
Yeah, Jim Calhane, thank you so much for taking the time to join us
You're
today.
welcome.
And we wish you a wonderful 20th anniversary celebration. We'll be there. And thank you for all you do in the community.
Thanks, Laura. Appreciate it.
Thank you. Back to you, Abby.
Thank you, Jim, and to all the great folks that make this beloved organization what it is. Do check out their website for more information on services, volunteering, or working with them. When we return, Sage Tokash from the New London Barn Playhouse will give us a sneak peek at all the wonderful programming happening this winter. We'll be right back.
This program is supported by Echo Communications, a digitally integrated commercial printer and mailer located in New London, New Hampshire since 1997, with roots going back much further as the Country Press, AccuMail, and the home of the Kearsarge shopper. Echo Communications.